Hi, my name is Anna Guerrero, and I'm be doing my presentation on marijuana for class 673-7A. What is marijuana? So marijuana and it comes in a dry leaf form. It has stems and flowers and seeds from a cannabis stevia or cannabis indica plant. One of the chemicals that marijuana has is THC. THC is a chemical that is considered mind altering. Um, from the plant itself, there's other extracts that you can get from them. They come in different forms. One of them is like in a form of like a gooey liquid, which is considered hash oil, honey oil. Another way is like a soft solid that has a texture like a lip balm, which is considered wax or butter. And a third way is an amber colored solid, which is considered shatter. These extracts have a large amount of THC, and that's what you inhale when you smoke it. One of the ways that marijuana is currently being used is to the use of vaping. When you vape, you're kind of like removing the THC is being pulled into a vapor storage unit, and then instead of you actually inhaling the smoke, you're actually inhaling the vapor. The history of marijuana goes back into 100 AD. It has been used by several different nationalities. Ancient Egyptians were using it for medical treatments. The Chinese were using it for other medical uses. The Indians have made a concoction where they use marijuana, milk, and water, and it has been used for several different medical situations like anesthetic, anti-phlegmatic. They've used it to encourage sleep, cure fever, and improve judgment and cognition. According to research, the drink is still currently used in India. In the United States, the use of marijuana didn't come into play until the 1600s, and it was grown like any other crop. It wasn't until the 1800s when they actually realized that it can be used for some medicines and over-the-counter products. Since then, it has transitioned through many different laws, and as we have seen, the news have been something that many legislators have tried to avoid to get to use for medication, for medical reasons or recreational. It has gone through lots of legislation, and it continues to be controversial until today. Currently now we have finally used it to treat some medical treatments that has helped some patients, like patients who are facing cancer or other chronic pain, but it also has crossed the line and become a recreational use. So there continues to be, controversy on whether it should be recreational at all. And this will continue, I'm sure, as we move further on. Marijuana is used throughout most of the population, adults, young adults, but it seems most prevalent in our young adults. It seems approximately 11.8 million young adults use marijuana in the year 2018, and I'm sure that that has probably gone up when they actually do again check. Um, Mostly is high schoolers that are using it, but there continues to be a steady movement increase in like middle schoolers. Vaping is the new way that we have seen a lot of students use marijuana, especially in the schools because of the fact that you don't smell it. So there's been an increase in vaping across the board with middle schoolers and high schoolers, with 12th graders being the most of using right now. There are many effects that marijuana has, short-term and long-term. Some of the short-term effects that it has is it alters the senses, it alters sense of time, changes in mood, impaired memory. There's also the risk that when you use it in young adults like middle schoolers, they can have some IQ changes. There's been some controversy about whether it's that or something else, but there have been some studies to show that those patients that don't use marijuana during the middle school and those that have used marijuana for a longer period of time have shown to have some IQ changes. Some of the long-term effects are like temporary hallucinations, paranoia. If you do have a medical illness, a mental health illness such as schizophrenia, it can cause you to have more disorganized thinking and paranoid hallucinations. There's also physical effects that are long-term, breathing problems, increase in heart rate. Um, According to the research, you can have an increase in heart rate for 3 hours. So having that increase in heart rate in older adults or people with cardiac issues can cause them to have like a heart attack or go into an arrhythmia. Um, there's also been issues with pregnancy, women who smoke um, during and after their pregnancy. Kids have had some issues with development. There's controversy on, whether marijuana is addictive. A lot of studies, they have been not studies so much, but there's people who believe that it is not addictive. But what happens is if you continue to use marijuana, there's a syndrome called marijuana use disorder. Um, we've done some research and it has shown that about 30% that use marijuana have developed this substance use disorder. Statistically, it has shown that people who begin before the age of 18 are 4 to 7 times more likely than adults to develop this marijuana use disorder. Studies have shown that when people try to withdraw who have used marijuana for long term have developed some withdrawal symptoms. And this could include like grouchiness, sleeplessness, decrease in appetite. They may have anxiety and craving. There's currently no medications to treat any of the withdrawal or the marijuana use disorder, but there are other therapies that can be used. So some of the therapeutic treatments that can be used for those who have been using marijuana long term and want to quit using are cognitive behavioral therapy. Um, this will help them to have like a different mindset. Most of the time, it depends on what the situation is. If they have other issues that may be contributing to the use of the marijuana, there also is contingency management and motivational enhancement therapy. There are no specific medications, like I stated before, that have been approved for the marijuana use disorder. But patients who develop problems with sleeplessness, this has been one of the things that they've been trialing, and there's further research that's being worked on. A lot of people continue to have sleeplessness. So with the sleeplessness, they have used some medications to try to help those that are having the sleeplessness issue. These include Ambien, Boost Bar, and Neurontin. One of the things that if you have a patient that we want to do is we want to recommend the patient to either start or continue with therapy. You want to help them to stay away from the environment or recommend they stay away from the environment in which marijuana may be used. And also other treatment, another treatment that may help is like recommending them to use like an AA, which they can be around others that may be struggling with addiction. This can help them to stop, continuing the use of it and have some support as they're going through the withdrawals. Also, informing the patient about long-term effects and and where to get help with the cognitive behavioral therapy would be something that will help a patient if they're really struggling. It seems like our young people are really struggling with like dealing overall with issues, and we are as providers need to be letting them know that some of the side effects that marijuana causes, because I think sometimes patients are misinformed. So if we inform them from the beginning about the side effects, like I try to talk to a lot to the kids that I see about starting it, not getting involved, and the side effects of it. and also letting the adults know that the use of marijuana can also cause you to have more anxiety, can cause you to have more issues with sleep. So just being informative as providers will help people just know about the cause, what causes this marijuana use disorder, and hopefully that'll help us to control the use of it.